Hi, I'm Mel. I'm one of the dietitians here at Active Health Clinic, and today I thought I'd spend a bit of time explaining the difference between a nutritionist and a dietitian. So it's a pretty common question that I think every dietitian and or nutritionist gets asked on the almost daily by family, friends and randoms. So basically, a lot of people do think that they are the same thing and they do use those terms interchangeably. However, there are some slight differences. So I thought I would go through it to kind of clear up a bit of the confusion today. So essentially, a nutritionist is able to give generalized nutrition information to patients or clients. So essentially they can give general healthy eating tips, and I know a lot of them do meal plans and things like that based on general healthy eating, which for some people, if that's what they want, it's great. It's an awesome thing, and they can really help in being able to go into detail with food and how people eat day to day. It is an industry that is not regulated, so they don't have to pay like a regulation fee or anything like that. And yes, they don't have like a regulating body. And they are also not disease or condition specific, which I'll explain in a second. So this is compared to a dietitian where we can give generalized nutrition information. Some still do, and we do on the regular give healthy eating advice because that's what we all do. It's what we've been taught, it's in our nature. However, we do have a regulated body, so we can be held accountable for our actions and for any big mistakes that we make. This is ensuring that we are not giving dangerous advice because we are talking about people's health. And so it is, quite important. And the reason why we are regulated is because we work in chronic disease management. So this is where nutritionists aren't necessarily, that's out of their scope of practice is probably better wording, as we as dietitians are trained to focus on evidence-based practice for chronic disease management and for just a general healthy population as well. So for example, a dietitian is able to work with someone with diabetes and diabetes management or invisible illness management. However, a nutritionist will not be able to give specific advice regarding that disease or condition. And this is why dietitians are so regulated, because we are dealing with chronic health conditions. And like I said before, with evidence-based practice, this is where we are trained to go through the current evidence, so this is through scientific journals, and read through them and actually assess whether they are valid and appropriate studies that have enough weight behind them to actually use that as advice or as a part of our interventions and our work with people, especially because you are talking about chronic health conditions. I hope that explained it well. If you do have any further questions or anything didn't make sense, please feel free to comment and I can get back to you. Thanks.